Pulmonary fibrosis is a term that refers to a large group of interstitial lung diseases that cause scarring in the lung tissue, or interstitium. One subgroup is the one related to autoimmune conditions. When working correctly, the immune system defends the body from infections or other types of damage by recognizing cells and tissues from outside your body. However, with autoimmune problems, the immune system is dysregulated and attacks a person's own tissues, causing inflammation and damage. The autoimmune diseases that are commonly associated with lung disease can also be referred to as connective tissue diseases. This is because they often affect the parts of the body that hold us together, such as our joints, muscles, and skin. The autoimmune diseases most commonly associated with interstitial lung disease are lupus, rheumatoid arthritis, systemic sclerosis, dermatomyositis or polymyositis, and Sjögren syndrome. Although we may associate these diseases with specific organs such as rheumatoid arthritis and joint disease, they can affect other organs, including the lungs. Some patients with autoimmune-related interstitial lung disease first develop signs and symptoms outside the lungs, such as in the joints or muscles. The evaluation of these signs and symptoms leads to the autoimmune diagnosis. Other patients may present with pulmonary symptoms first, and will likely be diagnosed with interstitial lung disease by a pulmonologist. In patients with known autoimmune diseases, lung disease can develop later. So a rheumatologist will be alert to pulmonary symptoms such as cough or shortness of breath. They may even recommend monitoring with periodic lung function testing. A rheumatologist is a doctor who specializes in the diagnosis and management of these autoimmune or connective tissue diseases. In this case, your medical history, physical exam findings, and blood tests are used to make the specific diagnosis. Part of the evaluation of interstitial lung disease involves looking for causes such as autoimmune disease. This means the pulmonologist might look at some of the same blood tests that a rheumatologist might order, or refer for evaluation by a rheumatologist if a connective tissue disease is suspected. Some patients are given a very specific autoimmune diagnosis, such as rheumatoid arthritis or systemic sclerosis, based on specific diagnostic criteria, including symptoms, physical exam findings, blood tests, and sometimes x-rays. In other patients, however, there are autoimmune features present, but they don't fulfill all the diagnostic criteria for any one specific diagnosis, and there may be overlapping features. In this case, other terms such as interstitial pneumonia with autoimmune features or undifferentiated connective tissue disease might be used. Management should always be coordinated between the pulmonologist and the rheumatologist. Once a diagnosis of one of the connective tissue disease-related interstitial lung diseases is made, the primary management consists of modifying or suppressing the immune system to some degree to try and halt the damage being done to the lungs and to reverse inflammation when it's present. For those patients who have progressive fibrosis as part of their disease state, their pulmonologist might consider the use of an anti-fibrosis medication to slow disease progression. Additional research is ongoing to determine the best approach to treat this type of interstitial lung disease. Other important elements of treatment include pulmonary rehabilitation, supplemental oxygen if needed, and management of pulmonary symptoms. Sometimes, if autoimmune interstitial lung disease is progressive and not responding to other therapies, lung transplantation may be considered. Connective tissue disease-related interstitial lung disease can have variable responses to treatment. Some can stabilize or even show some improvement with therapy, while others can be progressive over time. It's important to follow up with your doctor to monitor your symptoms and lung function over time. For more information and support, please visit pulmonaryfibrosis.org.